one of this webinar is one of many webinars that we've put on our Equality in Research Matters series. So this webinar comes from the Centre of Ethnic Health Research and from ARC East Midlands. So if we have the next slide, please, Laura. So today, the focus of this webinar is looking at statistical methodology and engaging with the public voice, working together to produce much better and much more meaningful research. So the focus, we have a range of speakers for today. We have Professor Laura Gray, Samina Begum, Jonathan Broomfield and Gurpreet Gruwal Santini, all going to be doing short presentations for us. Laura, if we have the next slide, please. So what format is it going to take today? Well, Laura is going to start off the discussion and she's going to talk a little bit about how a statistician sees PPI inclusion within statistical methodological research. And then we're going to have a public contributors perspective by Samina. And then we're going to have a case study presented by Jonathan Broomfield. And we're going to finish our formal presentations by community engagement and statistical methodology research by Gurpreet Gruwal Santini. But that leaves a lot of time for our discussion at the end. And can I ask you, please, we do have a chat or a Q&A session button at the bottom of the Zoom screen that you can put your questions in, and we'd really want you to embrace questioning. This is about a very interactive session after the formal presentations are finished. So I'll come back to the chat and the Q&A section at the end, and then the speakers, the panel, will be able to answer any questions that you have. So please don't hold back on anything that you want to ask. So our first presentation is going to be by Laura, who is going to speak to us about her involvement in the statistician's perspective of including PPI in this type of work. So over to you, Laura.
Thanks, Marion. Okay, so thanks everyone for coming. I guess just to get us all on the same page, I'm hoping I'm preaching to the converted, but what is patient and public involvement? Well, this is research with or by members of the public or patients, rather than them being included as participants. So this is where members of the public become active members of the research team, on a level playing field with the rest of the team who work on the research, rather than being participants. And not everyone here might know what statistical methodology research is. So this is research about how we do research. So I asked my friend ChatGPT to give me a definition, and I think ChatGPT has summed it up quite nicely. So statistical methodology research is a field of research focused on developing, improving, evaluating, or comparing statistical methods that are used to design, conduct, analyse, or interpret data from research studies. And today we're talking about statistical methods applied to health and care research studies in particular. And I've got a couple of examples here. So simulation studies are something we use quite often in statistical methodology research. This is where we make up data with known properties, and then we can compare methods to see which method gets to the right answer, a way of validating methodology. At the bottom, you can see there's an article that's looking at a different kind of design. So an incomplete step wedge trial design. So it's not just about methods for analysis, but also methods for design. And more statisticians now are developing statistical programming capabilities in order to implement those methods. So the last one is an R package. So R is a type of statistical software. So all of these types of studies, they're trying to move forwards the field in terms of how we do our statistical methodology. And you can probably grasp from what I've said already, this can seem quite far removed from actual direct patient benefit. We're not working sometimes in particular clinical areas. We might be looking at a method generically, but we do hope to improve patient outcomes by applying better methods within the applied research studies that we conduct. So a few years ago now, I was applying for a fellowship, and this was the first time that I'd had to undertake PPI myself for a methodological project. I've been involved in PPI in some of the applied healthcare studies that I work on, but I've never actually undertaken PPI myself. And I was very anxious about how I was going to do something that was meaningful and useful. I didn't want to just do run a PPI group because I had to have something to put in the box of the NIHR application form. And so I went online and I did a bit of Googling, and I tried to find examples of what other people had done in this space to try and sort of enthuse me as to what I could do. But I didn't find a lot actually. And so this has led on to a whole program of research, of developing resources and trying to think how we can do a better job for statistical methodology research. And you can see on the screen an example of, I put some slides together that had far too many sort of clip art pictures. I was trying to explain in sort of pictorial ways the research that I intended to do. I didn't get the fellowship, but I did get congratulated on the PPI that I had undertaken. So that seemed like a success at the time. So I wondered if this was just me that was feeling anxious and nervous and underprepared about undertaking PPI for methodology research. And at Leicester, I work within the Biostatistics research group. So we're a whole group of about 40 people that undertake methodological research, right from PhD students, MSc students, up to professorial level. So I put a call out to the group to say, is anybody else feeling a bit like me? And would you like to get together to see if we could do a bit of a better job on PPI? And actually about 25 people turned up to a meeting. So within our group, it was obviously an issue that lots of people were concerned about. And we spoke about what we were finding difficult about PPI. And these are the types of things that came up. People were worried about the complexity and the technical nature of what we do and how to explain that in lay language. We all felt very inexperienced and had quite high anxiety about conducting PPI. Some of us didn't have a clinical application to the work that we do. So some people in the group worked in particular clinical areas, so cancer, for example, but some people didn't. So they were concerned about who they would go and speak to. Also accessing PPI groups, knowing which PPI groups existed. Did you need to make your own PPI group? There were challenges around getting funding to do public involvement before you'd actually got a grant, how to fund that. And when you did have some money, we had lots of issues about how you pay people for their time when they have come and contributed to your work. And I could probably give a whole talk on payment issues. I think it's something lots of us have difficulty with. But we all felt that we wanted to do a better job. Most of us are funded by the NIHR. So we wanted to do something better as a group. And we wanted to develop some resources that might not only help us do a better job, but might help the wider community as well. So we decided to undertake a survey of statisticians to see if what we were feeling at Leicester, there were similar feelings elsewhere. And I'd say there was definitely two camps of statisticians. So there was one group of people that felt very much like we did. They wanted to do PPI. They could see the impact it had on applied studies, but they were a bit scared, didn't know where to start. But there was another group of statisticians that felt that PPI was very much a tick box exercise. We were just doing this to tick a box for the funder. What could a member of the public possibly add to a statistical methodology project that's very complicated and very technical? We hope we can persuade some of those people that actually you can get meaningful input, and we've definitely had the work that we work on changed by the input of public contributors. So of the people who responded to the survey, about 80% have never undertaken any PPI to inform their methodological research. About half reported feeling not confident, and nearly everyone felt that there was not enough research in this area. So we decided to recruit a PPI group that would specifically focus on the work undertaken within the biostatistics research group. And we called this group PPI Smart. So it's patient and public involvement with statistical methods and research techniques. And we put an advert out in the People in Research website, and we thought we would struggle to recruit, but actually lots of people were interested. So that was the first learning. There are people out there that want to get involved in this type of research. And we worked with our PPI group. We recruited 8 members. And the first thing we did was develop an animation. We then went on to develop some case studies and then a glossary. And I'm just going to talk briefly about each of these resources. So one thing that we heard quite strongly from our PPI group was you needed to tell people what statistical methodology research is in an accessible way, and you really need to tell them why PPI is important within this type of research, because that's not always obvious, even when you've described what the type of research is. So we worked with our PPI group to develop a short animation. I should say you can have access to the slides afterwards, and all of these QR codes should take you to the websites where the resources are held. You're free to use any of them. So we worked with a company called Nifty Fox on this animation, and it's really nice because it uses an analogy of finding the right tool for the right job to describe what statistical methodology is. And it does a really good job of saying why public contribution is really important within this type of research. Our public contributors then said, well, the animation is great. It's something we can send to people when we're recruiting for particular studies to help them feel a bit more prepared when they come to our meetings. Because one thing we had found is that when we held meetings for methodology research, we got lots of people that were highly experienced in PPI for applied studies. And when we started talking about our research, it came as a bit of a shock that it was completely different to anything they'd been involved in before. So we thought the animation would be good for sort of setting the scene. Our PPI group then said it would be really nice to have some case studies. And this came out of the survey as well, that statisticians also wanted case studies. So they could see how PPI could actually make a difference in practice and what some examples of statistical methodology research looks like in practice. So we've developed a couple of case studies now on our website. We want to expand on these. You can see on the screen animated me. We developed short animations which describe the case study in a very accessible way, and the animations are more for public contributors to understand what was done within the study and how public contributors helped. And then for each animation there's an infographic sheet to go with it, which talks a bit more about the nuts and bolts of how we went about the PPI, what worked well, what didn't work, and any tips we'd give to researchers. Again, these are available on our website, so please have a look. And Johnny's going to be talking about his case study that's on the website today. I think it was actually Samina, who is with us today, that said that she'd found the glossary on the NIHR website really useful, but actually not many of the terms that we used in statistical methodology research were covered, and it would be really useful to have a glossary of the words that we use. So that started a whole nother piece of work looking at how we could develop sort of accessible definitions for some of the terms that we use within our research. I think we now have about 61 terms on the website that we've got definitions for. We had to accept that actually there's only so lay a couple of sentences can get. So we're now working to have some visualizations that go along with these definitions. So can add a sort of pictorial side to the definition to help explain what it means. But again, these are all freely there for you to download and use within your research projects. Another thing we've done is started a PPI for statisticians community of practice. We felt like there's more and more work being done in this area, not just by us, but by a much wider group of people. But it can be quite difficult to find. Some of it gets published in papers, but quite a lot of it doesn't. Some of it can be in recorded online seminars like this one, as a blog. So we wanted a place, a sort of central hub where people could share their experiences, share what's worked for them, and increase sort of chat and collaboration within the statistical community. So we have a mailing list, and we also have a LinkedIn page as our main way of sharing resources. And you can see here the seminar series that we have. We've got 2 seminars left this year, one looking at PPI for early phase trials and one looking at PPI in evidence synthesis. So the details of those are on our LinkedIn page, and I'd encourage you to join if you're interested in this area. And we're also open to public contributors who want to learn more as well to come and join the page. And finally, we've recently been awarded and started a grant in this area, which we're really pleased about. So we were funded through the MRC's Understanding Public Involvement in Non-Clinical Research call to develop some guidance in how to conduct PPI for statistical methodology research. It's a 2-year project. We're currently recruiting people who are currently undertaking PPI. We want to observe PPI groups, see what works well, what doesn't work well. That can sound scary, but our researcher Julie is really friendly, and I'm sure it would be a positive experience to be involved. What we want to do is to develop some composite case studies. So these aren't case studies that show an individual's experience, but they learn from all of the qualitative work that we're going to do. So they'll be anonymous in a way, because we're aware it takes a long time to develop a relationship with public contributors. And both the public contributor and the statistician might not want to talk about what hasn't worked well and then have that written up as a case study. So all of the work that we do will retain anonymity. So if you're interested, please get in contact with me. And finally, just some reflections from the work that we've done to date and how it sort of changed my view. I think we need to make PPI part of our day job. Before, it was only something I did when I was applying for a fellowship and I had to do it. And that's already a really stressful time. So then throwing in undertaking an activity that you've never done before makes it even more stressful. I think if it's part of our job, if it becomes something we do, that removes the mystique and we get better, because it's definitely a skill you need to practice. There's lots of support out there, particularly through the NIHR. If you have an ARC, Biomedical Research Centre, a research support service where you're based, reach out to those groups because they have PPI coordinators, PPI managers, and these people are expert in doing PPI, can really help you. I would say never run a meeting alone. That's something that I've found really stressful. I have no training in how to facilitate a meeting. I've had an experience before where I had a very chatty PPI member, which was great, but I was being very polite and I didn't want to shut down the conversation or interrupt. So they literally spoke for the whole meeting and nobody else got a chance. That's not ideal. And actually having a PPI coordinator there to chair the meeting or a colleague so you can concentrate on the science part is really helpful, or even if they can just take notes for you. Gurpreet's going to talk about community engagement, and that's really helped develop my confidence. Gurpreet will tell you more about what's involved, but it's talking to people who don't even know, in some cases, what research is or what PPI is, let alone what statisticians do. I really like the opportunity that this work's given me to be a bit creative in my work. We do a lot of cutting and sticking at the community engagement events. Thinking of creative ways to describe what we do is quite nice when normally it's just me at the computer. I used to panic about how public contributors could help with my research. And actually someone said to me, why are you worrying about that? Come to the group, tell us in an accessible way what your research is about and what you're trying to achieve, and we'll tell you how we can help. That's our job as public contributors. And that was amazing because it just took the pressure off and I was like, oh yeah, of course. So that's been brilliant. I really like reading about the experiences of others. So please do share if you have done PPI in this area. And I would say that actually the PPI and the community engagement is improving all areas of my work, because when you have to explain to someone who knows nothing about statistical methodology research what you're doing and why you're doing it, it makes you really understand what you're doing and why you're doing it. And it should be easy to tell someone, but I found sometimes I'm like, actually, now I've started to talk, I'm not sure why I'm doing this. So it makes you really think through the importance of your work. And I think all of us have sat in presentations that are sort of death by PowerPoint or equations, and actually being able to talk in an accessible way is really helpful, not just for members of the public, but for everyone. So they would be my main reflections. So now I've got the privilege of interviewing Samina, who's a core member of our PPI Smart group, and she's also a co-applicant on our MRC grant. So Samina, do you want to just start off by telling us a little bit about yourself and how you became a public contributor?
Hi everyone, thank you for joining us today. And thank you, Laura, for putting that question to me. I think my journey started in 2015, and I live in Bradford, so I was involved with we got a funding from the National Lottery for 10 million, and that was to set up projects in Bradford looking at early years outcomes, because Bradford was one of the 5 sites that was most deprived for early years. And that funding came through in coordination with Born in Bradford. And I'd never heard anything about research before. So when I became part of this, I became a community board member, looking at the projects and looking at tenders and having that public involvement in how these tenders should go out. But the other side was Born in Bradford had the contract to then evaluate all these projects. And that was my sort of first journey into research. And what I found was that I thought, how I've never been involved in research, and how did I not know about this? Because it just got me really into trying to understand what research was and and even the projects had difficulty collecting the evidence. So that's the data collection, and the community were having difficulty saying, why do we need to fill all these forms in, and why do we need to give all these details, and what is all this evaluation? And it took a real long time, but I've just found that that was in 2015. By 2018, with Born in Bradford, I came on their community research advisory group, and that was where they were doing projects and from the funding around early years outcomes, and researchers would come and present their ideas, and then we would give them feedback. And I think my very first meeting, I remember the researcher was using academic language. He was very nervous, and we just, the idea that he put forward, we just said that isn't going to work, and the conversation just stopped there. And I think from both sides, it was trying to say, well, how do we move on from this? This idea doesn't work. What do we do next? So that was my first experience. But one of the things that I found was by year 5, I realized what change of theory logic was. I never knew about it. And this word was used all the time. And it's only until I went to do a bit of research, and then I got a research to actually explain it to me. And then I understood. So that's sort of where my passion has come for research.
And so 10 years of PPI experience, and then what attracted you to the PPI SMART project? Had you heard of statistical methodology research?
No, so I had been doing funding, a review for funding applications for birth arthritis, the NHR, and Cancer Research UK. And when I looked at the applications, although we were supposed to only comment on the PPI element of that, I just felt, I need to understand the whole of the research and this idea. And there was a section where they would have maybe a statistician coming onto the application as a co-applicant. And then there were sections around methodology. And I thought, I don't understand all this. And I felt that, I wasn't able to give a really good insight to the project because I didn't understand what that was about. And it's very hard, in IHR or in any funding applications, they'll come back and say, you don't need to worry about that. You just focus on the PPI element. But I think PPI for me was about, I need to understand how can PPI be involved in every aspect, So, that's where sort of attracted me to the SMART project. Also, my own experience of, I failed my GC O level in maths twice. I'm not really good at maths and figures, and I seem to get brain fog as soon as I'm trying to calculate or work out data. And I came across it and I thought, I had this fear of, I'm going to sort of make a fool of myself, or I'm not going to understand. All these voices sort of came and said, you're going a bit out of your depth. But I thought, I'm not going to listen to them, and I'm going to go apply for it because I feel I need to understand and learn, So that was, my motivation for applying for it. And it was something different. I'd done various things in PPI. I'd done things like data analysis and things like, co-authoring papers and other aspects of research that I'd not come across. And it just sounded quite fascinating as well. Yeah, so that was sort of my reasons.
Feel the fear and do it anyway. That's
yes,
great.
Yeah.
And how have you found it? Has it been fascinating?
I think the first couple of meetings, I didn't really understand because it's that fear of, you come in and you think, I need to understand from the first meeting that what the research is about and what is my role in there, or our role as PPI. And it took a while, but I stuck at it, and I thought, I'm not still getting it. But I think as we developed the PPI group and the other contributors, we supported each other because we were all asking questions, but we were learning from each other. And I think we were all in a bit of the unknown. And just like, Laura, yourself in that group as well, in that research, it was a different way. We were testing it out. It wasn't something that you had done before. It was anything that we had been involved in before. So it was a great way to learn and develop. And I think the co-production was really good because you really, there was no hierarchy. You allowed us the safe space to talk about things that we said that's not going to work, or we don't understand this, and you went back and you rethought about it, and then you came back again, and presented it. So I think having that relationship with the researcher really helps to put PPI at ease, and you're more willing to say, okay, I'm going to work with this, because the way that you're being involved in that aspect of the research.
Great. Yeah, well, and I've definitely learnt a lot from you as well, Samina, so I think it works both ways. Is there any advice you would give to statisticians who might be thinking about undertaking PPI but a bit nervous, and any advice to public contributors that might want to get involved in this type of research but might also be a bit nervous?
First of all, researchers, I think you need to get out in the community and you need to start talking to people, because sometimes sitting in an office and a desk, as I've learned from the Community Research Advisory Group at Born in Bradford, they've never done any community engagement. They've never spoken to PPI. So I think it's really good to just have an informal meeting and just go and see and go visit groups, or even, you'll have within your own universities, you'll have, like you said, PPI leads, and there should be some PPI groups that you could maybe attend as an observer to see, how does this work? Because I think you need to think about environment, but you also need to think about practical things that you've talked about having two people there. But I also think it's a test and learn again. Don't go in and expect that I'm going to get really good feedback for the idea. PPI might just sort of tear it really apart and do real critical sort of damage to it. But I think that is better, because at least then you can think about the research and think, okay, I'm glad I did that, because I didn't waste my time, doing it this way, particular method. And I think hearing from patients who've got lived experience about their health conditions, that can impact on your research as well, or how you do that. So I think that's quite important. And I also think about think about the wider people as well, people who aren't reaching your research that you want to hear from. So that could be, people with learning disabilities, people who are vulnerable. So it's then thinking about, how do you get those people involved as well? And it's about, again, making connections and making connections. But I also think the other side of accessibility is thinking about, and which we did on the PPI Smart, was visual, the animation, the case studies, and also, the glossary. I think one of the things is not to focus so much on the technical. That's what we've learned from the PPI Smart. Don't focus on the technical aspect of, statistical methodology. It's got to be relatable to PPI and them in their situation, their language as well. So you need to sort of break it down and make it really understandable to their circumstances, and also, and that's where the case studies really good come in. So I'd go for things like visual, and you've also talked about creative, how to make it a bit more interesting as well, using different methods. And finally, to the PPI people, I would say to people who are nervous, I think having a chat with a researcher if you're not sure, and speaking to them and finding out, what is this about, and relaying your concerns as well. And that might mean that you might need to have, some support around that or some training. And, your resources are really good on the PPI website, PPI Smart website. And I also think maybe buddying with another PPI contributor who's had experience in that can help. Because sometimes I think you sit there and you have all these sort of negative things coming, negative thoughts about it. And actually, when you spoke to somebody, you realise that it's not as bad as you think or really technical. So I think that's important to think about looking at PPI support as well.
Right. Thank you, Samina. That's how we should sell statistical methodology research. It's not as bad as you think. I love that.
Yeah.
So we'll end on that for now.
Okay, thank you.
And we'll move on to Johnny, who's going to tell us a bit about his case study.
Thanks, Laura. Yeah, I think a lot of what Laura and Samina have both spoken about will probably come up in my talk as well, which hopefully underlines it rather than gets too repetitive. But yeah, I'll be talking about my kind of first involvement of patient and public involvement in my career as a methodologist, which we've got, as Laura said, is a case study on our PPI Smart website as both an animation and an infographic if you want to learn more. But yeah, so a bit of context for what the project actually was. So we were kind of focused around this a disease called Duchenne muscular dystrophy, which is a rare disease that affects about 2,500 boys and men in the United Kingdom. So it's linked to an X chromosome. So a few girls and women do get it, but very, very small numbers. And once the patient's been diagnosed with it, which happened, it's inherent because of the genetic condition, it's present at birth and diagnosed generally by the age of 4. And patients then lose muscle strength over time, so their muscles degenerate, and they lose kind of key functional abilities. So they lose the ability to walk and then to stand and eventually to move their arms, and as a result, at a much higher risk of a variety of morbidities. So where we came into it at the University of Leicester was to be approached to help build a natural history model as part of Project Hercules. So Project Hercules is a project set up by a couple of mothers of children with Duchenne who were kind of growing quite tired and frustrated with how long it was taking for potential treatments to get funded. And one of the mothers who was kind of had experience working in health technology assessment, and so had a lot of kind of first-hand experience from that side, and then kind of by seeing it on both sides, felt like there was so much that could be done to improve this decision-making process. And there was a particular example that was especially challenging, where a drug was eventually funded for treatment that had been available for years, but not kind of authorized. And so they felt like something had to be done to speed up that process. So they set up this kind of multi-stakeholder collaboration with a variety of different experts across different fields to try and standardize it for rare diseases with the example of Duchenne. So as I said, we were tasked with building the natural history model, which is a way of representing the disease progression. And because of the nature of Duchenne, it lends itself very kind of easily to a natural history model, because you can kind of model the different stages of diseases as health states that a patient kind of goes through. So you'd start off saying they've been diagnosed and then enter increasingly more severe disease states. And because Project Hercules was set up by these two mothers of boys with Duchenne, they were really keen that patients were at the absolute core of this project. So the whole project was quite patient-led and patient-focused, which I think is quite unusual in terms of these sorts of projects, and certainly unusual for the statistical modelling part of it, that it was so patient-led, and that members of the public and patients attended like steering group meetings and were present for all of these like model updates, and in particular deciding which stages of the diseases should and shouldn't be included in the model. So if you go to the next slide, Laura, we'll see what a lot of previous models for Duchenne did was break it down into two kind of mutually exclusive states, where patients either could or couldn't walk, so ambulatory or non-ambulatory states. And then there's a variety of other kind of subcategories that were quite common. So things like ventilation status, if they needed support breathing, or if they'd been requiring further treatment for other things like corticosteroids to delay some of these later stages. And if you look at that and you think that there doesn't seem to be anything like inherently problematic or like we're missing anything, it seems quite natural to say, here's the stage of the disease where you can walk, but we will break that down. Here's the stage of the disease where you can't walk, and we'll break that down. And then here's the risk of dying at any point within that model. And that's, you know, from a modelling perspective, that's a completely appropriate thing to do, and it seemed quite statistically valid. The only problem is it's missing a really key stage of the disease that no previous models had included, and that we only found out about through patient involvement. And that state is the transfer state. So this was a state that was included for the first time in the Hercules model, and it's a state where the patient can support their own weight, but they can't walk any distance. So that's really key for a few reasons. So first of all, patients said they had a much higher quality of life in that state. They felt like they could do a lot more and a lot more independent. And another key aspect of it was that it had a really big economic bearing on the model, because if they are able to support their own weight, then you only need one carer with them kind of around the clock. So that could be one parent, or it could be a funded carer. But there's only one person that's needed, because they could support their own weight. The carer then takes the wheelchair away and supports them into bed or onto the toilet or wherever it might be. But once they lose the ability to bear their own weight, then they require two carers, one to support them and the other to be on hand for moving them from one place to another. And that's just like, it's such an important stage of the disease for all these reasons, but it's completely understandable reasons hadn't previously been included, because you wouldn't know unless you were speaking directly to someone with that disease. And yeah, the fact that the patients were central to the project was why we identified this. And even then, we went through many kind of model iterations, and should we include it or shouldn't we? And one of the big reasons against including it was that we just didn't have any data on it. Because it was this new state, like people weren't collecting data, and you didn't know how to say if someone was in that state or not, because it's quite a tricky thing to define. So in the end, we managed to kind of elicit some data and ask kind of clinicians and healthcare experts and patients and carers about typical ages that they would expect to transition between these stages, and then simulate some data from that. And we were also able to suggest going forward how it might be important to collect data on this to validate that aspect of the model. But I think it's really important to include this. It was really vital that this was included. So yeah, if we go to the next slide, one of the big findings was that there was a 1.5 year estimated length of stay in this disease state. So that's a massive portion of these patients' lives that's not being captured by previous models, that is because of this example. And without the patient perspective on this, we would have completely missed it. And as a result, we probably would have underestimated the quality of life, because patients would have just been assumed to enter the later disease state of non-ambulatory, rather than first passing through this transfer state. So I think while this is kind of on the more applied end of a methodological project, it goes to show how important these the public and patient perspectives are on all aspects of like statistical modelling, and that the patients will identify problems which the researcher might never consider. And I think again that goes back to Laura's point that as researchers we can feel a lot of pressure to know how public contributors are going to help with our project, but that's not our job to know, because by definition we don't know what we're missing. And the purpose, like our responsibility, is to explain what we're doing in a way that the public contributor can then offer their perspective and make suggestions. So it's a really important kind of two-way conversation to have. And if you think you know what you're going to get out of it going into it, I think you're doing it all wrong, and then you're not going to listen to any fresh feedback. You're only going to listen to things that agree with what you were expecting to find, which is kind of the opposite of what you're trying to achieve. And then just, I guess, some wider reflections of what I've found. So, as I said, this was my first experience of patient and public involvement, and It was the first project that I worked on, so I think that's really rare, and it was really good for me to kind of see the importance of this, because a lot of my colleagues kind of didn't have that initial first exposure to it, and so it's then quite tricky to see the benefits unless you have these case studies. And it was also it was rare, I guess, to have this like patient contact as more of a methodologist, and that was something I didn't really anticipate going into the project. Was I'm going to be speaking to patients with the disease about the disease itself, and that was a kind of really useful experience for me to think about the language I was using, but also about the way that I was explaining some of the decisions and the statistical side of it, and how that could then kind of be fed back and how improvements could be made. But I think as methodologists, it's important to have this, and patient and public contributions can remind you of the direct impact that, even though some projects are more removed from an applied setting, they still have this big impact, and the goal is to improve healthcare. So I think it's an important reminder of that. And then because it was one of my first projects, it kind of helped me see PPI in my future projects, and it shaped and made me consider how I could get that involved. And I think until you do this, it can be really tricky to see how you can involve PPI in your project. But through case studies and through learning by experience, you learn to see how much more impactful your research can be. And then my final message for statisticians, I guess, would be that patients and the public want to be involved. And I think there's a perception that you talk about statistical methodology and everyone's going to their eyes are going to glaze over, and they don't want to listen too much to what you have to say, because it's typically seen as a boring kind of topic to be talking about. But that's probably because of the way that we're used to talking about it, and let's talk about it through equations and through graphs and methods and results and like all of the traditional formats. And it's inevitable that that's not the right way to communicate the research to a lot of people. And if you are able to present it in an engaging way, we've found time and again that people want to be involved and they want to help, but they just need to be given the platform to do that. So don't think that your project won't get any interest, because I'm sure if you can explain it in an accessible way, you will get a lot of interest in your project. Thanks.
Okay, and so last but not least, we've got Gurpreet, who's a Community Engagement Officer with the Centre for Ethnic Health Research, who's been supporting us with some community engagement. So over to you, Gurpreet.
Thank you, Laura. Good afternoon, everyone. And we've heard some really interesting insights about the work that we're doing. So I work as a community engagement, my name's Gurpreet, and I work as a community engagement officer with Centre for Ethnic Health Research and Biostats Research Group. Initially, when I was introduced to this new team, I was a little bit nervous. The opportunity was there, but I was somewhat reluctant to join because I really didn't have any research background. And I felt everything a little bit daunting, and I wasn't sure how I would fit in with the team and understand terminology, because it was my first time going into something so technical. But what I did have was a lot of experience of community engagement, over 35 years or so. I've invested heavily. I enjoy working with people. I've done public relations, media, community engagement in various ways, supporting communities, support groups, charities, community development. So I had a great positive from that side. And my manager said, just give it a go. And I felt, yeah, I should take this as a challenge. And I feel 2 years down the line that it has been really interesting for me to learn about this side that I never had much knowledge about. So I wanted to work with creative craft workshops kind of things, so which I will talk about shortly. So simplifying terminology was another thing that Laura's mentioned. I have been part of the team, even though a lot of work has been done by our colleagues there, but I'm always actively involved, and if there is any suggestions or anything that I can give, I would definitely I try and get involved in all those things, because we want to make all the terminology which is more relevant, that people can understand. It's simplified and easier for people to take it back to the communities where they have lots of barriers, language, and not actually understanding the kind of work that we do. And we've had some focus groups where people have shared what kind of things that they understand. As Samina mentioned as well, that when you are in that group setting, initially you think it's quite daunting to be talking about all these really difficult words, terminology, but when you are explained, but people see things differently as well. So when you have expert contributors like Samina, she would probably be in a better position to look at things which she may have some knowledge of, but then people who struggle with just research generally, they find it even harder, because all those words, they seem like really like a huge challenge for them. Next slide, please. So so in our PPI Smart meetings, we often have discussions which we in our team we meet fortnightly, and which Laura leads, and she would ask everybody what kind of projects people are working on, wherever there are any opportunities for PPI work. But we wanted to just sort of talk about how do we actually do this job properly, effectively, by engaging people in research and so on. So where do we find these people, and what kind of things would they like to do, and what changes can we make to ourselves, our own communication skills, and when we approach them, how do we increase that trust and that understanding, and if we were to publicize any opportunities, where can we do that? And also, a lot of the times when working in the community, members of the public often feel that it's kind of like one way. People go there, they're needed for PPI work or some sort of an interaction where they feel the researchers or that side gets some sort of a benefit by them being involved. But we just wanted to go out there and make friends. So the kind of community engagement that we're doing here, it's step before the PPI or the focus groups, which actually puts all of us in a really good place where we're not really asking so much. We're just asking them to just kind of like open the door to us, where we can enter their community premises, their settings, and we can experience how they work, and just having chit chats with them and just getting to know them. And then we gradually do ask them questions. Would they like to know more? And if there are any questions, then we answer some there and then. And people do ask about how they can find out more about things as well. And for all those things, we felt community engagement was the only option. So I came up with an idea of a craft activity, which I was trying to make it relevant to our team, the kind of work that team do using numbers, and something which is kind of like systematically following the numbers, and it has a pattern. So we went with iris folding, which originates from Netherlands, and it's like a camera shutter or iris of the eye. So you just go around the numbers, and but it is quite tricky as well, where you have lots of different tools, and the paper cuttings are all over the table, and scissors and everything. So you need to have almost like a plan in your mind. So we've done a few times in our within our team as well. We try and go through and make these cards before we take it to the community. So things like putting the strip, if it's a printed one, on the right side, so you get the picture when you turn the card over. So we've sort of like all of us learned it ourselves, and then taken it to the community. So this is one way of giving something to the community. People are so interested in just sitting and chatting and just talking about things. And I know sometimes people ask about our researchers, how can they get into research, or how can the grandchildren find out more, because they were enjoying so much being part of the group. For the researchers as well, I suppose it can be quite daunting as well, going into a community which they have no idea about, and on top of that, other languages as well. So this is a great thing that we take something with us. So you sit next to somebody, you just, can I help you? Or they ask for help. And then the conversation just starts. A room is always buzzing. People are laughing, joking, talking. But there are occasions when people do go completely quiet, when they're really concentrating on their task as well, which is really nice to see. And I'm going around taking some photographs as well when people are enjoying the activity. So, and we've sort of felt this has been good, and we are working on some of the crafts as well, but it has been working really well. And some people, when they finish slightly earlier, they want to make another one or take it home, and we've made cards around Easter, say, for bunnies and other things as well. So as far as my role has been with the team, community engagement through PPIE Smart and with the glossary terms, focus groups, and it's been for me, it's been really great just to see how people who are from the community, who have no research knowledge and who are experienced contributors, the difference in their opinions or their suggestions, and looking at the animations as well, how they see things has been really, really interesting. And we try and make it really accessible, where we use like coloring and the type of drawings there are. So it's suitable for most people, and it's not offensive or interpreted in a way that wouldn't be appropriate. And part of my community engagement, I have also supported some studies. For example, COVID-19 pandemic and cancer. We were looking at how during that time, how a lot of patients didn't get the right treatment. They felt that they weren't offered the right aftercare, and some of the treatments they were given, everything like, for example, radiotherapy or something, instead of weekly or monthly, they were given in a week or in sessions. So what effect would that have had on their health and so on, and traveling and not being able to see people and so on. And ethnicity missing data was also a great study where people were very much interested, and some people find it really fascinating how estimation and so on works with statistical methodology, and how they feel accuracy and so on, how it works. And obviously the researchers want to know how can we make it better, more inclusive and more meaningful. So it was a great debate there, and lots to do in that area, because the information in lots of places is very different, some accurate, some not, some estimated, and some sort of lot of guesswork in some areas. And earlier this week, we had a gestational diabetes event as well, which was partly funded by a Festival of Social Science. And we had really, really good engaging conversations there. The group that we visited through our craft work, a deaf group, were interested to come to this event, and which was really great to see. So the work that we're doing, it has an impact on our other work that we do as well. So far, we have visited about 5 different community groups, and we're counting. We're going to be going to another one in about a couple of weeks' time. So we want to go to as many different groups as possible, as many different backgrounds, as many different places where there are other languages used as well. So keeping in touch with the community groups is quite hard, because it just sometimes there are festivals or other things going on, and sometimes things are changed last minute as well. But it is really rewarding, I feel, in this work. For me, like I mentioned, especially this engagement work is really great, because we are actually just building those bridges with them, and we are making good connections with them. So I feel that for our work now and for future, we are really paving the way for better connections. all of the groups that we have visited so far, they've all said, when are you coming again? So we will be going back to them as well. So working on another craft activity, and we will be visiting them again. And it is always nice to have that they want more engagement. And sometimes they do stop us and say, whenever there's a study about this, that, and the other, please let us know. And we've visited a diabetes group, and they wanted to come and see our library, David Wilson Library at the university campus. So that visit was also organized last couple of weeks ago, and they thoroughly enjoyed it. And some of the comments were like, it's been so inspiring to learn. They were saying we are a little bit older, but if we did have the opportunity, they would want to study or do something else. But in any case, they wanted to learn more, which was really great. So, you know, through the work that we do, they are actually, in fact, learning a lot about things that go on around them, around health anyway. So I felt really good that they enjoyed it. And whenever there are any comments like that, I always try and make a note, and I discuss it with our team. If there are any things that we can do or signpost them, we would try and do that. All of us being in the community is making our connection stronger, and they are trusting us more and welcoming us more. So when there are festivals and other things, they often say, do come and, you know, join us with our things. So but, you know, like everybody only has so much time, and we do try and join in where we can. So with these small interventions, but really meaningful interventions, I feel we have increased that interest in health and research. And there are some people, some may be going through difficult times mentally, and they've also felt that by talking about other things and talking to people who had similar maybe health condition or so on, has given them a bit of a support as well, and they're interested in research. So from the deaf group that we visited, that was the very first time they had ever had any researcher or any kind of research discussion with them. And they've said, when we met them again on Monday this week, they were saying that we want to know more. If you can arrange an interpreter, please do. And this last interpreter we managed to arrange very quickly. So now I think this group is so engaging, and they spoke about stigma and so many other things that go on in the community. And I feel that we really need to have them on board wherever we can. So as Laura mentioned as well, about when you're doing any kind of any study or work, I think there should be some sort of arrangement made for some sort of funding for these interpreters, especially for the deaf community. Otherwise, they do get left out. So my personal reflections are that it has been really personally and professionally been a good development, positive for me. And I do understand a little bit more, like Johnny's presentation. I used to work at Rainbow's Hospice, and I used to see children who had Duchenne's, and I would have never thought about anything like what Johnny has explained, and how much of an impact it can have on their quality of life. So I suppose it's giving me a lot of knowledge to understand, which I can, I don't know, I mean, I probably won't using it on any other way, but I can pass that information on to the community groups, the kind of work that we do. So having that understanding and talking to colleagues is really, really great for me, I feel. And the work of organizing these workshops is sometimes challenging. And when we are there in the sort of like a workshop, it is so exhausting. I think we just need to come home and just put everything away, because first you're carrying all these boxes and everything, and then talking to people can be really exhausting. But you do feel really, you have really happy, positive, you know, things buzzing in your head as well. So flexibility. And if we want to see change, we really do need to engage with all kinds of different people from diverse backgrounds, and the approach has to be consistent. And it's always good to hear feedback. And if we can tweak or do anything, you know, it's all welcome on both sides. So we would do that. And I personally try and get involved in all kinds of departmental activities, away days or any training or anything, because that I feel, because I work only a portion of my time with the biostats team, getting to know them as people is great. So I get to understand how things are and what kind of people they are, because you know, I always used to think about how they would be like working with very technical things. So it's nice to have that human side as well. And I, at the end, I'll just say it's so really important to have research engagement in research to make everything so meaningful. That's the only way, by offering them that space and listening to them, making things simpler so that we can make our science stronger, make it more inclusive and really meaningful. Thank you.
Thank you, Gurpreet, and thank you so much for 4 wonderful presentations that I think really highlight that this is a new area. We're learning together, moving the area forward in lots of different ways, and really loved each one of your presentations, just a very different nuance of what it's like to set something up like this. So thank you to everybody for giving us some questions here. I'm going to just work my way through them. We've got another 20 minutes left, so